Hello, this is Dr. Kate Hughes at Abbey Medical Practice. In response to the current coronavirus pandemic, GP practices across the UK have changed how they deliver care to their patients, and we are no exception. The following message is long but very important. Please listen carefully. Even if you feel well, please do not attend the practice unless you have been given specific instructions by the team on when and how to arrive at the practice safely. Following advice from the UK government to move to the delay phase, all practices will move care to remote means where possible. You will receive a phone or video call from the practice instead of being seen face to face. If you are being offered a video consultation, you will receive a text prior to this appointment with a link explaining how this works, and then you will need to click on a subsequent link to allow the consultation to happen. This works best on Google Chrome browser on your mobile phone, and you will need to allow access to your video and mic when prompted to do so. The front doors of the surgery are currently being manned by one of our patient services team, and access for an appointment or path forms or other paperwork will only be allowed if this has been agreed by a clinician. You can submit an electronic request for care to the practice using the online consultation service. Using an online service will keep the phone lines free for those who are not able to use online services. Simply follow the links to the practice website at www.abbeymedicalpractice.uk.com. This website is also updated regularly, so do use this as a resource if you are unclear what to do. Please be aware that we are receiving high volumes of calls on the telephones at the moment as a result of changing the way that we are working. Do you have a fever and/or a cough? If so, you must self-isolate at home for 7 days to slow the spread of the virus. If you are still unwell after 7 days, or you feel unable to cope with the symptoms at home, you must contact the 111 coronavirus service. Please use the online tool where possible at www.111.nhs/UK/COVID-19 or call 111. If you have a family member who is unwell, then the current government guidance is that you must self-isolate with the rest of your family for 14 days. The government has asked employers to relax the sick note rules, and it is therefore not anticipated that you will need a sick note from your doctors if you are in this category of patients. If you are calling for another reason, please ensure you visit the nhs.uk website first to find self-care advice. This will help keep our doctors and nurses available to help the sickest people in our community. Provided you do not have symptoms of the coronavirus, you can also access high-quality advice at your local community pharmacist. If you have sustained an injury and are unable to manage it using first aid, you will need to attend your local minor injuries or accident and emergency department. Thank you so much for listening.